This is a presentation on military sexual trauma for the iReach program. First, a quick acknowledgement that this project was supported by the Health Resources and Services Administration of the U.S. Department of Health and Human Services, and a disclaimer that the contents of this presentation and myself do not necessarily represent the official views of, nor an endorsement by, HRSA, HHS, the Department of Veterans Affairs, or the U.S. government. In this presentation on military sexual trauma, there are 3 learning objectives. So by the time you finish this presentation, hopefully you will be able to first identify or define what military sexual trauma means. It's also referred to MST. Second, identify the effects of MST and some of the consequences and adverse outcomes that those who are exposed to MST face. And then third, learn about pathways to cope with MST, along with learning about the potential treatment options that are available. So first, what is military sexual trauma, or MST? MST refers to any kind of sexual harassment or sexual assault that was experienced during military service. So for sexual assault specifically, this includes any kind of sexual activity that happened without the consent of a person or against that person's will. And this can include sexual activity by means of physical force or coercion or pressure. So it can take a wide range of forms, but the underlying shared characteristic is that the sexual activity itself was without the consent of the person or against their will, regardless of how or what happened. Then the last thing that's important to point out here is that MST can happen to anyone. So there's likely some stereotypes or misconceptions about who is the type of person who's most likely to be a survivor of MST, but the reality is that, and the prevalence rates, the prevalence is there within the military, that this happens to all different kinds of ages, happens to all genders, men and women, happens to all different kinds of races, ethnicities, sexual orientation. It doesn't matter. Anyone can be a survivor of MST or can have that experience forced upon them. And then we also know that this occurs in all branches and all areas of service. Okay, what are the effects of military sexual trauma? So right out the gate, it's important to point out that not everyone's experiences after MST are going to be the same. There's going to be a wide range of short and long-term consequences that people experience, which will differ drastically between folks based on several different factors. The short and long-term consequences that someone might experience will differ based on the actual nature of the sexual trauma, but also it's impacted by that person's other experiences in life history. What kind of life had they had and struggles had they gone through? What kind of history with trauma had they experienced in the past prior to that assault? All of these things, all these components can play a role in what kind of consequences or effects people experience after MST. So that's important to note, that everyone is going to experience these effects differently. But some people who experience MST will develop PTSD and related symptoms. So we know that the core symptoms of PTSD involve re-experiencing symptoms, so intrusive thoughts, memories, nightmares, flashbacks of the traumatic event, in this case of the sexual assault or the sexual trauma. Those might be some things that are experienced. Avoidance symptoms, so avoiding anything that might trigger thoughts about the sexual trauma or avoiding people or places, that could lead to thoughts or reminders of those things. Changes in beliefs and emotions, so this can include a whole range of differing thoughts about, or changes in thoughts about how you perceive yourself, how you perceive the world, how you perceive other people, in addition to, a lot of times people have anger associated um, with PTSD or in the aftermath of experiencing MST, not to mention shame and guilt, even if they were the person who was victimized. People will experience intense levels of shame and guilt and sadness. And then hyperarousal, high levels of being on edge and hypervigilant and maybe difficulty sleeping. And, so these are all core common symptoms of PTSD that people with MST can also experience, and may even be diagnosed with PTSD as a result of that sexual trauma. So that's one area where people might experience effects. Another way that people might experience effects is just infrequent but still distressing symptoms. So it's possible for some folks to experience MST but then not have full-blown PTSD, not have all of these symptoms necessarily, but it would not be uncommon for them to still experience, symptoms that pop up occasionally or unexpectedly and are really upsetting and really difficult to deal with. And, maybe this person is still able to hold a job down and still keep their relationships together, but it can still make living their life very difficult and cause other kinds of impairments. So some people might experience those infrequent but distressing symptoms. And then other effects of MST involve additional problems beyond trauma and PTSD, but things related to physical health, poor physical health, difficulty sleeping. Other problems can emerge as a result of coping with all these other symptoms and the aftermath of MST. Another thing just to point out quickly as well, because MST involves sexual assault that occurred during military service, it's also really common for folks to experience a strong sense of betrayal related to this incident, especially if the person who committed the sexual assault, was someone that they previously trusted, so maybe a fellow service member, or it's also not uncommon for people to have a sense of institutional betrayal. I trusted my unit or my branch, or I trusted just the military structure in general to look out for me or protect me, and people can feel abandoned after they were assaulted, or if people tried to follow up and proceed with disciplinary actions for the person who committed the act that fell short or that weren't met with support and the necessary justice, there can be strong sense of, I feel betrayed by some people or group of people that I trusted beforehand, and that by itself can be difficult to deal with. So that's another effect of MST that might be encountered as well. Okay, now how to cope with MST or seek treatment for MST. So maybe the first and most important thing starting at the bottom is to point out that there are treatments that are available for this problem, for the effects of MST and for PTSD that's associated with sexual assault during military service. And so there are several treatments that are available that we would call them evidence-based practices, which means that there's a whole long list of research and researchers who have investigated these specific kind of treatments and have shown that they are effective tools for not just for veterans, but for veterans with MST. So we know that they do work, they can work, and so there are treatment options that are available to you if you find yourself in a place where you say, hey, I'm actually ready to talk about this with somebody else. I'm ready to talk to a therapist about my experience with MST, or to try and overcome that. I'm ready to start working on that as a treatment. And so, if you find yourself in that place, the first step that you can do is call your VA provider and ask to speak with an MST coordinator. There are MST coordinators at most of the VA centers, and they can help you get connected with the right therapist who has the experience and the expertise and the treatment that you need and that you want. But also, if you have specific preferences where, for you it would be easier to talk to a male therapist or a female therapist, whatever it is, any other kind of like background or experiences that are important to you, an MST coordinator can help set that up so that you feel as comfortable as you possibly can and increase the likelihood that you'll be able to pursue treatment. Again, if you feel like you're in a place where it's a good time for you to do that. Another option for treatment is just looking into your local vet center and ask if they have MST-related counseling. And so if they do, that's another option for you. If you're maybe not in that place where you say, hey, I'm not ready to talk to somebody about this. I do not feel comfortable. I don't think I'd be able to take that step and meet with a therapist to talk about this issue. That is perfectly okay and understandable, and also not uncommon for many folks to need time, or they have to be ready to be able to engage in treatment related to PTSD and MST in general. So that is perfectly okay. However, that doesn't mean there's nothing available. There are still resources that you could look into that might be helpful as you just try and cope with it until you feel like you're in a good space to maybe pursue treatment in the future. So the first resource that is at the top is Beyond MST app, and that is an app that you can download on your phone, whether it's Apple or Android. And this app was made by the VA, but it includes a whole range of resources and education materials and exercises that you can do. But what's nice is that it's all done by yourself. You can just do it on your own, at your own pace. It's meant to be just a tool that you can kind of have in your pocket with you wherever you go, and a tool that you can use as much as you want if you're looking for additional coping strategies or support along the way. So that's one resource that's available. Another one is the SAFE helpline. So you can call that line, that phone number, which is operated by the DoD, and that provides support that's anonymous and confidential, which is important for many folks who, if you experience sexual trauma during your military service, there's oftentimes concerns about, retribution and, how will this impact maybe your career, or concerns about how you'll be perceived by people in the future. This provides anonymous confidential services to offer support. So that is an option if you want to talk to somebody without diving into treatment right away necessarily. And then lastly, there's a website called Make the Connection, which has several different videos of veteran testimonies who've experienced a wide range of struggles and battles, how they overcame that, what they did, what kind of treatments were effective for them, that sort of thing. And within Make the Connection, there are several videos that specifically feature veterans who are MST survivors, who've experienced that, who struggle with it, who are coping with it now, or who have undergone different treatments or approaches that have helped them on their path to recovery. And so if you want to see a video testimony of some other veterans, or even just get a sense of what have other veterans done, what has been helpful for them, you can go to that website. You can search the video library for MST survivors specifically, and you can even filter it to look at veterans of different gender and branch and era of service as well. So these are all options for you if you feel like I'm not quite there. to seek treatment, but I still want something to help cope right now. Thank you very much for listening to this presentation. Please feel free to check out all the other presentations and modules of the iReach program along with the fact sheets. There is one fact sheet linked with each presentation, which also includes additional resources and suggestions. Thank you again.